One of the most painful situations which a person can find himself is when a parent, a spouse, a family member are in a situation which is called end of life. Heartbreaking decisions have to be made. Even more so in today's day and age, where medical technology has so much advanced that almost every case of end of life, interventions can be made. And then people have to start hearing doctors say, but it's not appropriate, should we do it, shouldn't we do it, it's quality of life. If this would have been my mother, I wouldn't have done this. We hear that all the time from doctors. So people get lost and they're torn. They're watching their loved one slipping away. And there are options. Should they request the options? Should they not request the options? Are they doing the right thing by refraining, or should they be more aggressive in asking for interventions? Or maybe it's not the right thing to do. They need guidance. Unfortunately, most rabbis, heads of congregations, are not trained in this field. They have minimal knowledge of medical issues, even less so of halachic medical issues. And even talking to the doctors isn't productive when the rabbi does not understand the medical terminology. Doctor is saying this word and this description of a certain test or a certain procedure which might or might not be done, or what are the outcomes, and the rabbi is lost. So if he doesn't know, he can't give guidance to the family. So it's extremely important that the family have a resource to reach out to. What do I do now? Here in Canada and in Montreal, every serious patient has to be approached by the medical staff and request that the family give advanced medical directives. It's called level A, level 1, level 2, level 3, level 4, level A1, 2A, and level 2B. You know, when the doctors start talking with these it's like Greek, and people don't even know what they're talking about. I have to decide, and I have to tell the doctor which level I request, and it's a fateful decision. So they get lost, and many times they turn to me and ask me to come to the meeting with the doctors. First of all, if the doctor sees that the rabbi he's conversing with is fluent in medical terminology, it makes a huge difference. It's like two intelligent people talking about an issue which both understand. And also the family, you know, I can't tell you how the family is relieved to hear and see that a halachic professional is talking to a medical professional, and both they're speaking the same language, and they respect each other, and they reach a mutual beneficial conclusion, which is good for the family. I have these questions almost every day, because everyone who is in an end-of-life situation needs guidance. So I can give scores of situations, but it's all the same. The question is, what do we do if the situation deteriorates? Should we issue a DNR? DNR is do not resuscitate. Or shouldn't we? Should we issue a DNI? DNI is do not intubate. Or shouldn't we? What interventions should be done? Should a blood transfusion be given? Should antibiotics be given? Should we attach an IV to hydrate the patient or not? So there's so many questions which, if the rabbi doesn't know what these issues are or what these treatments are, it's almost impossible for him to give an educated answer. So that's why it's so important to have someone to be able to reach out to. Baruch Hashem, that not only families reach out to me, rabbis reach out to me, I get calls all across the country of rabbis that they have their congregants coming to them with questions. So they reach out to who can give them guidance on what they should answer to their congregants. So I feel that I've much to contribute, and Baruch Hashem, it's made a major difference in the treatment that people are getting. I have to say something also to add that. When I came here, without mentioning names, the head of one of the major hospitals here came to me quietly and told me that as long as I am the head of this hospital, we will respect your ruling when it comes to Jewish patients. So if you rule a certain procedure should or should not be done, a certain level of intervention, we will respect it. So this is a result of seeing that my approach was based on full knowledge of, first of all, the medical issues, and be able to pair them with the sources in Halacha.